Hello everyone. Today I will be talking about the ureters, their anatomy, their vascular and neural relations, and their clinical importance. By the end of this session, you should have a clear understanding of how the ureters course through the body and why they are so important in both normal physiology and surgical practice. So first of all, we have introduction. The ureters are two muscular tubes that serve as a simple but vital role. They carry urine from the kidneys to the urinary bladder. Each is about 25 centimeters long, although this length can vary slightly depending on the individual's height and kidney position. They are bilateral, meaning there is one ureter on each side and each ureter drains a single kidney. Their muscular walls contract rhythmically in peristaltic waves, ensuring urine moves steadily toward the bladder regardless of body position or gravity. Then there is anatomical course overview. The course of each ureter begins in the kidney and ends in the bladder. Anatomically, we divide this course into two main parts, an abdominal portion and a pelvic portion. This division helps us to understand their different relations and blood supply in each region. First of all, we will discuss about the abdominal portion. The ureter originates at the renal pelvis, which is a funnel-shaped structure within the hilum of the kidney. The point where the renal pelvis narrows to form the ureter is called the uretero-pelvic junction. This is also one of the common sites where the kidney stones can become lodged. From here, the ureters descend vertically through the abdomen. They travel along the anterior surface of the psoas major muscle. Importantly, they remain retroperitoneal, meaning they are positioned behind the peritoneum. This retroperitoneal position makes them accessible in surgery but also somewhat protected. As they reach the level of sacroiliac joints, the ureter crosses the pelvic brim. At this point, they also pass over the bifurcation of common iliac arteries before entering the pelvis. This crossing point is another frequent site where stones may get stuck. So this picture depicts the abdominal part of the ureter and also shows the pelvic part of the ureter in relation to the psoas major muscle and common iliac artery. Second one is the pelvic portion. Once inside the pelvis, the ureters follow the lateral walls downward. When they reach the level of ischial spines, they curve forward and medially, taking a transverse course behind the toward the bladder. On reaching the bladder, they do not enter directly. Instead, they pierce the bladder wall obliquely. This oblique entry is functionally significant. It acts as a one-way valve. When bladder pressure rises during filling or urination, the ureteric openings collapse, preventing reflux of urine back into the kidneys. This is a critical protective mechanism because reflux can lead to infections or kidney damage. This figure shows the pelvic part of the ureter, where ureter is passing at the pelvic brim. Then ureter is entering at the bladder dome and with their entry, which is called ureteric orifice, opening into the bladder. Then we will study about the vascular relations of the ureters in both genders. First of all, we will discuss about vascular relations of the ureter in females. In females, the ureters have two very important relations that surgeon must always remember. First, as the ureters crosses the pelvic brim, they pass very close to the ovaries. This means that during oophorectomy, the surgical removal of an ovary, the ureters are at risk of being injured, especially when the ovarian artery is tied off. Second, about 2 centimeters above the ischial spine, the ureter passes under the uterine artery before reaching the bladder. This relationship is remembered by the phrase water under the bridge. The ureter carrying urine or water runs beneath the uterine artery. The bridge during hysterectomy, when the uterus and uterine artery are removed, the ureter is at risk of being accidentally clamped or cut. These two relationships highlight how close the ureters are to the gynecological structures. So this figure shows the vascular relations of the ureters in females, and picture is clearly showing that here how ureter is entering the bladder and uterine artery is passing behind the ureter. This picture is also showing the similar picture. Then vascular relations are the ureters in males. In males, the situation is slightly different. Instead of the uterine artery, the ureter is crossed anteriorly by the vas deferens. This is the duct that transports sperm from the testes to the urethra. Again, this relation is surgically important, particularly during operations involving the prostate or vasectomy procedures. So this figure shows the relations of the pelvic segment of the ureter on the left side showing the relation in females and on the right side showing the relations in males. In males, clearly we can see that ductus deferens is passing anteriorly to the ureter, while in left side we can see that uterine artery is passing behind the ureter. Then we will discuss about the blood supply of ureters. Let's move to the blood supply of the ureters. Because of their embryological development, the ureters receive segmental blood supply from multiple sources. In the abdominal portion, they are supplied by branches of renal arteries, the gonadal arteries, either testicular or ovarian, depending on sex, either male or female, and by small direct branches from the abdominal aorta. In the pelvis, they are supplied mainly by the superior and inferior vesical arteries. And venous drainage parallels this arterial supply draining into the renal, gonadal, and vesical veins. Clinically, this means that when handling the ureter surgically, it's important to preserve the surrounding tissue to protect its blood supply, which is not a single vessel but multiple segmental branches. This picture is showing the blood supply of the ureters. Then we will discuss about the nerve supply of the ureters. The ureters are innervated by several autonomic plexuses, the renal plexus, the gonadal plexus, and the hypogastric plexus. Sensory fibers from the ureters enter the spinal cord at the level of T12 to L2. This explains why pain from a ureteric stone is felt in certain areas. It does not always stay confined to the flank. Instead, the pain can radiate downward toward the groin, scrotum in men, or labia in women. This is a classical example of rapid pain linked to the dermatomes corresponding to those spinal levels. Then clinical significance, we will explain about the ureteric calculus or ureteric stone. Clinically, the most important condition affecting the ureters is the ureteric calculus or stone. A stone is formed when minerals in the urine such as calcium oxalate or uric acid crystallize and grows into a solid mass. When a stone moves from the kidney into the ureter, it can obstruct the flow of urine. This causes renal colic, which is an intense, sharp, and often unbearable pain. Patients may also pass blood in their urine, a condition known as hematuria. There are three main points where stones tend to lodge in the ureter. There are three narrowings in the ureter. First of all, stone can lodge at the uretero-pelvic junction, also known as PUJ. Secondly, stone can lodge at the pelvic brim where ureter crosses the iliac vessels. Third one is the vesico-ureteric junction where the ureter enters the urinary bladder wall. To diagnose suspected ureteric stones, the gold standard investigation is a CT scan of the kidneys, ureter, and bladder, also known as a CT-KUB plane. It is a quick, highly accurate, and can detect even very small stones. So this picture shows sites of the narrowing or constrictions in the ureter where stones can dislodge at various points. Like firstly, stone can dislodge at pelvic-ureteric junction. Secondly, bifurcation of common iliac artery, and thirdly, at the intramural part of the ureter, where ureter is entering the urinary bladder wall. To conclude, the ureters are muscular tubes about 25 centimeter in length, responsible for transporting urine from the kidneys to the bladder. Their cores can be divided into abdominal and pelvic portions, and they have important relations with major blood vessels and reproductive structures. Their blood supply is segmental, and their nerve supply explains the characteristic rapid pain of ureteric colic. Clinically, they are most significant in the context of ureteric stones and surgical risk during pelvic operations. Although small, the ureters are crucial structures, and understanding them helps connect anatomy, embryology, and clinical medicine. So that is all for today's lecture. Hope so all of you will get a take home lesson. So thank you very much for your attention. Goodbye.